Hi, everyone, and welcome to the mini lecture on cocaine. So this is for psychopharmacology. So chapter 6 covers cocaine, a stimulant drug. And since we've already covered caffeine and nicotine, you know that plant-based alkaloids can act as very powerful and addictive stimulants, but cocaine is quite addictive, especially when you think about the way that people typically use cocaine as a psychoactive recreational drug, as a drug of abuse. So in that form, that's typically snorting or dissolving in water and injecting cocaine. The other way that individuals will use it is the crack form, which is the crystal form of cocaine that can be smoked. And that reaches the brain very quickly through the lungs. And so as a stimulant drug, it's often used for recreational reasons. It does have some medical reasons, so we'll talk about that as well. But again, we're continuing on with psychoactive stimulant drugs when we talk about cocaine. So here's a picture of the plant that cocaine comes from. And you can see in the image here, it's not very distinctive. It just looks like any old plant you would see maybe growing in your backyard if you just didn't pay attention to your gardening and things like that. It's a plant that won't grow really well around where we live. It needs really hot, humid conditions. That's where the coca plant really thrives. The cocaine in the plant discourages insects from eating the plant. And you probably recognize that this is the same thing that we talked about when we talked about plants that had caffeine in it, and then the nicotine in plants also discouraging insects from eating the tobacco plant. So a lot of continuity when we talk about these stimulant drugs. So the leaves of the plant are pulled off the plant and dried and chemically processed to make cocaine powder. And so, it takes some effort, just like it did with caffeine and nicotine, to have the psychoactive drug in a form that humans could ingest. Okay, so in the previous chapters, I didn't really cover a lot of video information about history, but I do think the history of cocaine is kind of interesting. So I'm just going to touch on it a little bit this time. The chewing of coca leaves off the coca plant has occurred for about thousands of years, beginning in South and Central America. And it's interesting to think about this history because it tells you that chewing the leaves is really not very dangerous. It doesn't cause the problems that we see with, snorting of cocaine powder or something like that. Again, this goes back to this issue that we talked about in previous chapters about if you ingest a drug through the gastrointestinal system, the drug reaches the brain quite slowly. And so individuals who use cocaine in this way, and even today, they use it in this way sometimes in South American countries. It can actually have some beneficial effects, like if you have altitude sickness, you're really high up in the mountains. It can be used for energy. In the Inca civilization, they would send people running through carrying messages for days, like long distance marathon runners. And so if they had some cocaine leaves, they could chew them for energy, like an old-fashioned version of today's energy drinks or something like that. It was believed to be used as an anesthetic as well. So as you know, from history of other classes, when people thought that they had mental disorders, they would drill holes in the skull of the person to release the evil spirits. Well, that exactly is something that you might want, something that anesthetizes the area. So cocaine was used for that. Obviously, drilling holes is not effective as a way to treat mental disorders, but it tells you that the anesthetic properties of cocaine potentially were useful. And so when the Spanish conquistadors conquered the Inca people, they brought these coca leaves back to Europe. And that's where Europeans then learned how to process the coca paste and turn it into pure cocaine. So I'll give you sort of the comparison that a coca leaf only has 0.5% cocaine, whereas purified cocaine, you can turn it into 99%, right? So just kind of interesting to think that, there's this plant that is growing and it might have potentially medical uses, but we tend to have very negative connotations today when someone mentions the drug cocaine. Um, so historically, both in Europe and North America, it was used quite a bit during the 1800s. It was common, for example, in 1869 for people to drink Vin Mariani wine, which is wine, so an alcohol beverage steeped with coca leaves. So combining the alcohol sedative drug with the stimulant cocaine. Sigmund Freud wrote extensively about cocaine. He advocated for its use in various medical reasons. I kind of elaborate more in the chapter about this, so you can read about that more. And then the other bit that's a little bit fascinating is that in 1886, Coca-Cola developed a medicinal drink that was made with the cola nut containing caffeine and coca leaves containing cocaine. So at the turn of the century, cocaine was removed from Coca-Cola as the public started to become wary of cocaine. But, back in the 1800s, there was significant use of it. And cocaine started to become strictly regulated around 1914. The use of cocaine in the United States kind of ebbs and flows. Beginning in the 1970s, it was increasing in use, peaked in around mid-80s, mid-1980s, and then crack came on the scene, which is the smoked version, widely available in 1986. And so you have a period of time in the 1980s where it was widely used by all segments of the society. Maybe powdered cocaine by people who have more affluence, access to funds, and then individuals who did not have as much money, they might have gravitated to crack. So currently, where do we stand with cocaine? It's a Schedule II drug, meaning that it has potential for abuse, but it has potentially medical usefulness. So it's limited in use. Use of cocaine might be as a local anesthetic or as a vasoconstrictor. So if you had to do something like eye surgery or throat surgery or something like that, cocaine could be used in that case. But for the most part, we get concerned about the potential for abuse. It's not a widely used medical drug. When you think about how people use it, obviously you can orally ingest it. The chewing of the coca leaves even still occurs today in some of the native peoples in South America. But here in North America, you would see more inhalation, intranasal snorting of cocaine powder, inhalation with the crack cocaine, and then injection in some cases. And so again, how fast it hits the brain, it depends on how the cocaine is coming into the body. Intranasal, the route of administration is going to affect how long it lasts. So intranasal 30 to 80 minutes, inhalation 10 to 20 minutes. So since crack cocaine is the inhalation route of administration, then if someone only has something in their system that lasts about 20 minutes, then they may go to the next dose sooner. So that makes crack cocaine potentially more prone to abuse just because the action is so short. So why do people use it? Well, I already alluded to the fact that it does give you energy, right? So even the native peoples were using coca leaves for that reason. We know it improves endurance, especially in high intensity, long duration activities. It increases alertness, arousal, talkativeness, all of these things stimulant drug effects, right? Restlessness, motor activity. It may improve cognitive processing, but the findings from research studies are kind of mixed. So you may ask, Are we doing research studies with cocaine? And the answer is yes. So in lab studies, you can bring people in who are cocaine users and then make sure they don't have any cocaine in their system. And then you give the person a dose of cocaine and look at the effects of the cocaine on that individual. So if you're interested in that kind of thing, it is research that's done here in the University of Kentucky in the Department of Behavioral Science. So they do work like that if you're interested in that. And sometimes people are quicker to respond in these studies, but more error prone. So they're like fast but sloppy. That's kind of the findings. But yeah, there isn't as much research on the acute effects of cocaine because it's challenging work to do. You obviously have to be concerned about safety when you give cocaine to human subjects. And so you would want to do that in a hospital setting with oversight by a medical team. It's expensive work to do for that reason. And so sometimes we're also relying on the work of animal studies to inform us about these sorts of things as well. Subjectively, how do people feel? Again, it's a stimulant drug, so they feel alert, energetic, really confident, to the point where they're grandiose and euphoric. They feel great, they feel happy, they feel intense pleasure, especially if it's smoked or injected. It can also, that stimulant effect can lead to some aversive things like feeling nervous or high anxiety. And brain imaging studies show increased activity in the nucleus accumbens, coinciding with the feeling of high or rush that people feel when they have the drug in the system. In the body looks like the fight or flight response is being induced. Okay, so that fight or flight response, is consistent in effects like increased heart rate, increased blood pressure, body temperature rises. You're not interested in eating, so appetite is suppressed, and it potentially can induce seizures. It can increase interest in sex, although the literature on that is a bit mixed. But certainly all of these fight or flight response outcomes, your body's not meant to be in the fight or flight response over and over and over and over again. And so if someone uses cocaine a lot, this is going to be detrimental to their body. The body's not meant to be constantly on alert and dealing with crises. So, and another thing that happens if the person uses a lot is they sometimes can develop psychotic symptoms. So this is where someone, their uses of cocaine leads to paranoia, hostility, belligerence. It can cause delusions and hallucinations, and it's associated with violence. As you remember, they're in this fight or flight response, so they're ready to fight. And so on the whole, this is called stimulant psychosis because it's psychosis induced by a stimulant drug. Another thing that's aversive in users is this thing called formication syndrome, where the person feels like bugs or insects are crawling on their skin and it's really itchy. It is a hallucination, right? That there are no bugs, but they feel like they are. And both cocaine and amphetamines can induce this. And it can lead chronic users to be so upset about that hallucination and so uncomfortable that they might shave their head or something like that to try and like eliminate a place where the bugs can hide in the hair or something like that. So, definitely a real aversive outcome. And stimulant psychosis is obviously very concerning because when people aren't in touch with reality, they can act in violent ways that don't make sense. They can be out of touch with reality and harm other people or harm themselves. The lethal dose for cocaine is a little difficult to determine because it seems like the main way that people die if they are using cocaine is that a heart attack is induced. So they have a myocardial infarction. You're in that fight or flight response over and over and over again as someone who uses cocaine repeatedly would be in that state. And then eventually the heart can't handle that. The other thing to consider as well is psychoactive drugs tend not to be used in isolation. So someone who uses cocaine tends to use other drugs, and alcohol is a common one. And interestingly, there's some research that indicates that when you put alcohol and cocaine in combination, the body makes this new cocaethylene, and that really intensifies cocaine's effects. And users will like that effect, but it's also associated with greater risk of sudden death. So, you know, these are all the things that we learn in research studies. It's not that using cocaine is without any risk, but usually the myocardial infarction is the main concern. The chronic effects. So cocaine use tends not to be a drug that is used every single day at a certain set time of day. It tends to go in binge patterns. So someone might not use cocaine for a while and then use a lot in a row, dose after dose after dose. And so repeated use is associated with overdose or accidental injury or violence. Someone can have a heart attack, as I just mentioned. If you're not hungry because you're in that fight or flight response all the time, you may develop malnourishment because you're not actually eating very much food. Dependence obviously is a big concern. And then depending on how the cocaine is used, there's certain specific things that could be problematic, like intranasal, you could have chronic nosebleeds, injection, you could have bloodborne diseases that you get, HIV, AIDS, or something like that, or vein damage from the needle injections repeatedly. And then if the person is inhaling cocaine, they can get crack lung. The lungs with repeated use of crack will develop, all kinds of problems, and not crack lung is very significant and difficult to treat medically. So use of cocaine, again, it tends to be used in a binge pattern. So you do see tolerance where you get tolerance does develop to the euphoria. So you have to use more and more, especially in a binge, like the dose that you used in the last injection may not be enough. You have to use more and more. The tolerance also develops to some of the cognitive and behavioral impairments you might see. And you see good examples of acute tolerance where the effects are less pronounced after the first administration, even when blood levels of cocaine are constant. So that is seen in both human and animal studies. Another thing that you see with cocaine is sensitization, bringing back all this terminology for you. So the first time you give a mouse or a rat cocaine, it'll show a little bit of locomotor activity, but then you give another dose, same dose, again, they show a little more locomotor activity, and each dose that you continue to give the mouse or the rat, the locomotor activity increases more and more. So that's sensitization. You see that in animal studies and human studies, and sensitization tends to be less well studied than tolerance for sure. And sensitization tends to be seen in studies with stimulants like cocaine. Cocaine obviously does lead to physical dependence and withdrawal. And so users are going to feel sick if they stop using it. It's not life-threatening. So not every psychoactive drug is like that. Some psychoactive drugs, the withdrawal effects are life-threatening, but cocaine, it's not. The worst symptoms will be in the first 24 hours, and they include deep depression and irritability, dysphoric mood, where the person really just feels very low and depressed, and can be very deeply depressed. Changes in appetite will occur, fatigue, unpleasant dreams, changes in psychomotor activity, sleepiness, slow heart rate, and they will crave the drug. Everything about their thinking will be thinking about how they can get the drug again. Now, pharmacology. Cocaine is structurally similar to dopamine. So cocaine blocks the dopamine transporter and slows the removal of dopamine from the synapse, resulting in more dopamine. And that's what causes the high, the euphoria, and increases behavioral activity. It is a fairly straightforward effect compared to some psychoactive drugs. And it's just because cocaine looks like dopamine. So if you want to treat someone with cocaine addiction, first of all, the first thing to take home is that it's difficult to treat because right now we don't have any FDA approved pharmacological treatments. So there's no medicine you can give right now. It doesn't mean that they're not investigating medications. They are. There's clinical trials going on right now to try different things to help people who have cocaine addiction, but we haven't got anything yet. So it is an area of research right now that's under investigation to help people. So what that means is that you are left with cognitive behavioral therapy to try and help people using behavioral approaches or residential treatment programs. And all of these treatments, they have found to be effective. Some are better than others, but I think that we can do better. So that's something that we need to work on. And if it's something you're interested in, that will allow you to really contribute to the new world of science, if that's something you're interested in. Thanks, everyone.